Okay, now for years, plastic surgery was often thought of as a procedure that was primarily for women only. But these days, more and more men are getting cosmetic work done for them. In fact, more than 1 out of 10 plastic surgery patients are now men. KTLA reporter Ted Garcia is one of those patients, and he joins us now with part 1 of a special 2-part series on male cosmetic surgery. Ted?
Hal, it was definitely a learning experience for me. You know, there are a lot of misconceptions about plastic surgery. People often think that it's only for the rich and famous, or you have to be pretty vain to get anything done. But for most regular guys like me, it's done for an enhancement of what you already have. And it's a trend for men that's definitely catching on. The sights and sounds of an operating room, but this is not your typical hospital. This is the private office of Beverly Hills plastic surgeon Dr. Brent Moelleken. For more than a decade, he's been nipping, tucking, and lifting body parts of the famous and not so famous. And these days, he's seeing more and more male patients.
I'd say when I started in practice, it was maybe 5% males, but I think we're up to 15 now. 15% males.
In fact, according to the American Society of Plastic Surgeons, in 1999, 11% of all plastic surgery patients were men. The top 5 most popular procedures for men: liposuction, eyelid surgery, nose reshaping, breast reduction, and facelift. Every surgery starts with a consultation. I wanted to slim down my baby face.
So then we want to contour your jawline a little bit better, make it a little bit crisper, and there's just a little lack of proportion between the nasal tip and the chin, so we can bring that out a bit by putting in a chin implant.
And just a few weeks later, I was lying on a gurney in a hat and gown getting some last-minute instructions.
We should be talking within a minute of the surgery being done. Within 60 seconds, we're going to be talking.
Finally, Dr. Moelleken started the first of 3 procedures. First, fat extraction from my cheeks. This is performed from the inside of the mouth. Blobs of fat the size of goldfish are taken out.
That's what makes the cheeks full.
Next, liposuction under the chin to give it a more pronounced look.
Yeah, a lot of fat's coming out here, so that's great. For the area under the chin, this is going to make a nice difference for him.
And he's not finished yet. Tomorrow night, how this little object will play a big part in the surgery. And the bandages come off. Everybody here is like, oh, yuck! You know, you really don't need a movie star salary to afford most of these procedures. Many people finance their surgeries, which is what I did, but it's really a small price to pay for making yourself feel pretty good. And there is a website we want to put up, drbrent.com. He is answering questions for you if you have any questions about plastic surgery for men or women or anything. So that is part 1.
You know what's interesting? You say tomorrow the bandages come off.
Right.
You can see
we see the after.
Here it is. Wait, don't look at me yet. Yeah, tomorrow you're going to see the before and after.
Okay, pretend you're not seeing Ted. Okay.
Thanks, Ted. And coming up next.